guys, I am really enjoying doing this video series and I'm learning a little more every day. I'm finding different neat little tricks that I can do within the video program, and I'm experimenting with it, and I'm not going to make them perfect when I send them out. So I know there's some sound issues in here. I know there's some editing issues, and I know some picture issues. I'm learning. Until I get really good professional equipment, this is as good as it's going to be, but the content I'm happy with. If you like it, please subscribe. Please tell friends. Please leave me comments and ask me questions if you would. We're going to get right to it. Here we go. 64-year-old client comes in. She has some shortness of breath. She's very tight up in her shoulders. And she's also complaining of some tightness and some pain on her inner thighs. Did a full body massage, sent her home. She was loosened up a little bit. She came back. She was tight again. Over time, what we discovered was that she had recently changed jobs. After having an active job for a number of years, she was in a position where she had to sit a lot. So there was a lot of inactivity and a lot of computer time. She's also a person who holds a lot of her stress, and that was starting to show itself up here in the shoulders. She had breast augmentation, so they were a little bit larger than average, and that was also part of the issue because of gravitational pull, and there was a tightness up here. After a while, what we started to find too was she had a hysterectomy scar, one of those old 30-year-old hysterectomy scars, and it went from hip to hip. And then after a while, I was working on her in the prone position and noticed that there was a linear difference in the gluteal fold as it came off the top end of her sacrum. What I'm going to show you here in a second is I have an actual picture of this, and we'll throw this in. This fold coincided with this area, which was an appendectomy when she was 5 years old. Once I had all these pieces of the puzzle, we were able to go in and do a lot of visceral manipulation and a lot of myofascial release and a lot of scar work on the hysterectomy scar as it paired into the appendectomy scar, and how it pulled in the parietal peritoneum all the way up into her chest with the breast augmentation scarring as well. Every single one of these scars, which is indicated in red, every single one of these scars was pulling every time she did this over the course of time. And it was manifesting itself the worst down here in her thighs. So that after about 3 to 4 weeks, she comes in for a regular treatment, and we have to loosen this up over time. After a period of about 6-7 months of regular treatments, this started to relax a little bit, and now she just comes in for maintenance. I have an anatomy app with a 3D model so that we can look at this structure three-dimensionally. Okay, so on this model, I'm going to mark the scars at first in black and then in red. We're going to remove the skin. Now we're going to get down to muscle. From muscle, we'll go down to the peritoneum. From the peritoneum, we're going to go into omentum. We will remove the omentum. And then we're going to remove the peritoneum and the guts. From there, you can see the cavity as it goes all the way through. Here's an arrow showing how that dimension would look. And then we're going to flip it around 360 and look at the cavity, noting in the back end just above the iliac crest where that deformity in the gluteal fold would have been, and picture this three-dimensionally. Because it's really important when you start having these types of scarring mechanisms inside the fascial networks, how to be able to see that and understand the surgical procedure, the time that she's had between the surgical procedures, and how it's affecting what she's coming in and telling me when she comes in. one of the things that I think is really important, and I've had a lot of clients that have gone through this, when you have a scar like an appendectomy, a surgical procedure like an appendectomy, when she was 5 years old, we're talking 3 feet high here, right? The body is so much smaller. This scar was probably no more than an inch on a 5-year-old, right? As she grew, 40, 50 years, this scar went down and out and up and around three-dimensionally. And then when you added this giant piece of scar tissue here, where they opened this cavity up, pulled out all of the female parts that they pull out in a hysterectomy, based on what I feel, this scar tied in with this scar, and it was pulling all the way to the back here. And through palpation and through manual therapy and through myofascial release and understanding the systems, the structures, and the fascia, she's had a lot more relief, and I didn't have to do a lot of work down here. All the work started up here and got pulled back up, pulled back out, pulled back to its normal structures so that she could just walk around without pain.
And at the end there, I cut myself off and I lost the feed. So if you enjoyed this, please subscribe, like and subscribe. If you have friends in the massage world or the body moving, body working world, please have them look at it and subscribe. Feel free to ask questions or tell me I'm wrong. I like debate and I'm not always right. So please feel free to interact and we'll keep this going. I'm going to end this here. Have a great day and keep coming back.